Aims to improve healthcare access and affordability by expanding BadgerCare to everyone as an option. Emily Byer brings us both sides.
Healthcare is a human right. I'm going to say that again. Healthcare is a human right.
The bill's lead author, Democratic State Representative Christina Shelton of Green Bay, says the BadgerCare public option is necessary for Wisconsinites.
It's not something that someone is entitled to only when they get sick or only when they're diagnosed with a life-threatening illness or when a family member comes down and they just need to get a flu vaccination or a COVID shot.
She says constituents tell her they're foregoing care and even going bankrupt from medical bills. This bill opens the BadgerCare program to everyone as an option, which could impact thousands of Wisconsinites. Supporters of the bill say this can benefit small businesses looking to retain employees.
And then what they see on their end is a difficulty of recruiting and retaining workers, because I've heard from small business owners who have said, I want to give health care to my employees, but they got health care somewhere else, and they can't blame them for leaving working with them to go to another larger place of employment for the health care.
Republican State Representative David Steffen of Green Bay issued this statement on the bill, quote, "Rather than expanding welfare programs for able-bodied, childless adults, we should be focusing on ways to engage more individuals in our workforce. Taxpayer-funded public health care dollars should be reserved for our truly vulnerable residents." Democratic leaders say they're willing to make amendments on the bill to work with Republicans. They hope to push the bill forward to get it into a public discussion. In Green Bay, Emily Byer, Action 2 News.